Morning, everyone, and welcome to Frontline's Healthcare Leaders Speak Out, the latest in BizWest business strategies coping with COVID-19 webinar series. I'm Jeff Nuttall, publisher of BizWest. COVID-19 has wreaked havoc globally with more than 4 million confirmed cases and at least 286,000 deaths, including more than 81,000 deaths in the United States alone. In Colorado, the latest numbers reflect about 20,000 cases, including about 1,000 deaths. Since the pandemic began sweeping the planet, the global economy has been in a tailspin, with more than 20 million people unemployed in the United States, including 420,000 who filed for unemployment just in Colorado. At the front lines of the outbreak are the state's hospitals, which have had to weather declining revenues as elective procedures were banned. They've dealt with shortages of personal protective equipment, ventilators and other supplies, creation of new products and practices to isolate COVID patients and protect hospital staff and other patients, and they've had to deal with the shortage of key personnel. Not easy. Today, we will hear from some of the region's top healthcare executives to discover what they've learned over the past several months, what the current situation is at their facilities, and how they're preparing for a potential second wave of COVID-19 infections. But before we begin today, I want to inform everyone that we'll spend about 30 minutes on questions at the end of all presentations. Please note that the Q&A button in the toolbar, the Zoom toolbar, of course, is there, and feel free to post those questions during our presentations today. In fact, we do encourage you to do so. Also of note, we'll be sending all of today's participants a survey about this webinar because we want to know what you learned and how we can improve. Our sponsors today are Anthem Blue Cross and Blue Shield and Caplan Earnest attorneys at law. And now Charles Ritz, Colorado president for Anthem, would like to welcome all of our audience. Charles?
Hi, good morning and welcome to the BizWest Frontlines webinar. My name is Charles Ritz and I'm the plan president for Anthem Blue Cross Blue Shield here in Colorado. We're so proud to be a sponsor for this informative webinar featuring some tremendous Colorado healthcare leaders as they share their challenges and successes facing healthcare delivery systems during this pandemic. Anthem has been serving Coloradans for over 80 years, and we serve all counties in the state. And we have a long-standing relationship with the provider community, and we understand the increased risk and strain on the healthcare system and want to seek to be a partner in the fight against COVID-19 and the long-term health of our consumers. And I think lastly, to the 5 healthcare leaders on the panel today, thank you for your time. And please, on behalf of all 2,000 Anthem associates and our 500,000 members, thank every one of your staff and frontline healthcare workers for all they've done to put others before themselves. I know this has not been easy and it's been extremely disruptive to communities, but especially to those frontline healthcare workers. And we thank them and we thank you and your organizations. I think times like this, we realize just how important it is to have quality access to quality healthcare in every community in this country. And I know that every organization represented on this panel today has done everything they can to deliver on that promise and that need. So thank you for taking time to join us. And Jeff, I'll turn it back over to you to get started.
Thank you, Charles. By the way, Charles will be handling our Q&A session a little bit later in the program. Our panelists today are Margo Karsten, Western Divisional President with Banner Health, Dr. Robert Vissers, President and CEO of Boulder Community Health, Dr. Andrew French, Chief Medical Officer at Centura Health, Jennifer Alderfer, President at Good Sam Medical Center, and Kevin Unger, CEO of UCHealth Northern Colorado. And our first presenter today was to be Margo, but I don't see her on the call yet. Margo, if you're there, please let me know. Sounds like she's not here. So we will just move right on. Our first speaker, I stand corrected today, is Dr. Robert Vissers. Robert has more than 25 years of clinical and healthcare management experience in academic and community hospital settings. He was appointed to BCH's Chief Executive Officer in July 2015 after serving as Chief Operating Officer since 2014. During his tenure as COO, he also chaired the Governance Committee for the CU Sports Medicine and Performance Center and served on the Board of Directors of the Friends of Colorado Hospitals. Ladies and gentlemen, please welcome Dr. Robert Vissers.
Okay, now I should be unmuted. You'd think after all of these calls, we would have gotten used to this. I want to start with a thank you and then focus on not just the preparation that we did, but in particular where we are now and how we are prepared for the future and your current medical needs. We as a healthcare system and everybody else on this panel is in a much, much better place than we anticipated because of the actions and the responsibility of our communities. And it really has made a difference. And you think about at the beginning, we spent so much time talking about flattening the curve and creating capacity. And the social distancing, the stay at home, as challenging and difficult and economically challenging as it was, it did allow us to build the capacity and never see the surge that exceeded the capacity that potentially would have and most likely would have occurred had we not taken those actions. So I think everyone here is grateful. And on top of that, a thank you for the support in many, many ways that came to our community, not ignoring the contributions when we were really short on supplies in order to keep ourselves safe and our patients safe. And a lot of that came from the community. We still get a lot of supplies from the community based on making masks at home or even innovations in printing swabs for us. So made a huge difference. What I want to do is talk about not as much what we did to prepare, although I can tell you that everybody on this call, all of us has worked to a place where we could potentially triple or quadruple our intensive care and our ventilator care and significantly increase also our overall capacity. And thankfully did not have to do that except for in some isolated cases. But I wanted to talk about where we're at today. Jeff, could you put the slide up that I provided yesterday?
Here it comes.
So this is something, and we look at data every day, and we have a whole war room, and I know everybody does, but we've narrowed it down to a slide that we look at every morning that lets us know where we're at. And I'm providing this to go through it just to highlight a few important things. One is where we are right now and how well we're doing, and the safety of the hospitals and the healthcare systems and how we're prepared to take care of you for the rest of your healthcare needs. We're not just here for COVID. In fact, it's a very small minority of what we're doing at this stage. So this was as of yesterday. We had 4 positive patients in the hospital and 4 that we were waiting for tests and 3 in the ICU. As of today, we have 3 that are in the hospital. All of them have been discharged from the ICU. No one in the ICU, no one on a ventilator. And those 4 that were pending were negative. And in fact, most of the patients that we've seen throughout this who present with COVID-like symptoms end up being negative, 80, 90% of them. Which also means that most of the patients that we're taking care of, and if you're sick, you need to come to the hospital and let us sort through this, but it's the minority of patients. If you look over down below, you can see that we've dealt with about 42 patients, 43 patients, and we've had 2 that we've had to transfer to UCHealth for ECMO, a very sort of a specialized therapy that doesn't occur very often. And I bring that up to say 2 things. One, we're very fortunate, and I think this has been a highlight, that in Northern Colorado, the level of care is extremely high. The quality is high, and the capacity is high. And the vast majority of patients are being cared for here. However, this also highlights how collaborative everybody's been. And everybody on the call represents a system where we've been on the phone with each other daily. We've worked together to share protective equipment, bed capacity, knowledge, and made sure we've moved forward safely and unified. And so I think we've always been partnered and collaborative, but also competitors. But this has really brought us all together. And I think you're going to see a health system, a global health system coming out of this that is better for it. The other thing I want to point to is the top right of the screen. These are tests that we've done, and now we're up to about 330. Before we do surgery, so we opened up elective surgeries 2 weeks ago, along with everyone else. And of the 300, so every person before they get surgery gets tested. Of the over 300 now that we've done, not one has tested positive for active COVID disease or had a positive test. So for me, all of this is reassuring that the efforts have worked. It's still clearly present in the community. We're still seeing positives, we're still seeing deaths, but the containment has worked, and most people don't have COVID out there. And the other final thing is down on the bottom right, you can see our employees. And we only test positive, or only test employees that are positive for symptoms. So we have about 2,400 employees. Over the last 2 months, we've only had 17 positive. Most of these, a vast majority, were positive at the beginning and community acquired. And we've done contract tracing. We've had at most 1 or 2 that we think might have acquired in the hospital. And so you're talking about thousands and thousands of hours of people working closely together around COVID patients. This doesn't mean that you can't obviously contract it from someone else, but it means that the hospitals are a safe place to be, and that it works if you wear a mask, you wash your hands, maintain social distancing. I think we can move forward and open up and remain safe, and the hospitals are a clear demonstration of that. And the final point, and if you can go away from the slide now, thanks, Jeff, that I wanted to highlight is, again, and I think others on the call will emphasize this too, is as concerned and as devastating as COVID has been, we're all starting to see the consequence of delayed care. And we're seeing less people showing up with stroke symptoms. We're seeing people with cardiac disease showing up delayed with much worse disease than if they'd presented a day before, a week before, 3 weeks before. Not to mention your routine care, your diabetes care, et cetera. And there's a growing concern amongst clinicians and our leadership that the delay or the fear of getting care is starting to lead to health consequence that far outweighs the risk of seeking that care. And so hopefully one of the messages is a reassurance that we're here to care for you, that you need to get your care, and we can do it very safely, and in fact, you'll be much better off to do so. So again, I just close with a thank you to the community. It has been a very challenging time. I will say that we will get through this. And finally, one note is all that work and preparation that we did beforehand, we all anticipate it doesn't go away, and it will pay off. And I know there's a lot of people concerned about secondary surges. We all believe that our monitoring is in place to see it coming a lot more quickly. We have the ability now to increase our capacity dramatically. So we're in a much better place than we were a couple of months ago as well, not only from equipment, but from a capacity preparedness and to meet any future surge. So I think overall, it's good news. Now, the economic side of it we'll talk about later, which is not so great, but there's a lot to be proud of and a lot to be grateful for. And I think at the end of all this, it will be looked back as, you know, despite the devastation, a success story. So, thank you, Jeff.
Thank you, Robert. It really sounds like Boulder Community Health has made terrific progress. You're to be congratulated. Next is Dr. Andrew French. Dr. French comes to St. Anthony North from Sister Hospital Castle Rock Adventist, where he was Chief Medical Officer since March of 2018. Prior to his role at Castle Rock, Dr. French worked as the Medical Director of the Adult Emergency Department for Denver Health Medical Center. Please welcome Dr. Andrew French.
Good morning, everybody. I would just like to start off by saying that I completely agree and echo with everything that Dr. Vissers just mentioned from top to bottom. From my perspective related to the COVID pandemic, I wanted to highlight a couple things, some of which build on and maybe a slight bit of overlap with what Dr. Vissers said. So, first and foremost, although the pandemic itself, I think, has appropriately, caused a fair amount of confusion, anxiety, concern, fear around what this actually is and how it impacts us, I think it has called out and highlighted the tremendous bravery, courage, and heroism by all of our medical providers throughout every single one of our healthcare systems, from doctors to nurses to technicians, all the way down the line. It's actually been incredibly remarkable seeing how they are taking care of these patients and dealing with this on the front lines. The second thing I want to highlight is that despite all of the craziness that this has resulted in, there's been an incredible amount of ingenuity and collaboration that has resulted from this pandemic. And so just wanted to highlight that in a few different ways that I've seen personally. So number one, within Centura Health, as we all know, and has been everywhere in the news, shortages of PPE, although I think most of us are doing fairly well with that currently. We engaged on a process at Centura to actually begin producing our own gowns. And so as the PPE shortage started to hit, our team here engaged on a process to actually produce their own medical gowns that we were then able to not only distribute to our healthcare providers within Centura, but speaking to the collaboration that Dr. Vissers mentioned, we were actually able to produce enough that we were able to collaborate and supply some additional healthcare systems with some of these gowns to help protect their providers. And so that ingenuity that's resulting from this pandemic has really been an incredible positive in all of this. The other thing that we've been able to engage on is mask reprocessing and mask sterilization and adopt protocols that weren't original necessarily to Centura, but as an example, there's some well-known protocols that use ultraviolet light sterilization. And much like PPE, some of the equipment used to perform that sterilization quickly dries up as people understand that this is something that they may be able to use to help and conserve personal protective equipment. So one of our teams here actually engaged on building their own equipment to the exact specifications required for the sterilization process. Again, just one more incredible example of how people have come together, used imagination and ingenuity to help battle and overcome some elements of this pandemic. And then, as many of us have seen, not only within Colorado, but across the nation, an explosion in the utilization of telehealth and telemedicine to help care for these patients and actually to conserve, in many ways, conserve PPE. We've also seen some interesting ways that it's been used to connect patients and families. As an example, we've been using in our hospitals and in our clinics, we've been using iPads for telehealth. And what we've actually been able to do is, as an example, we had a situation in our hospital where we had a husband and wife, actually, unfortunately, who were hospitalized together some weeks back and in separate rooms. And obviously we can't move them around, do those types of things related to COVID. And so they were actually able to connect with each other on a daily and frequent basis through the iPads and through the systems that we would normally have in place for telehealth and medical evaluation, but to connect with each other and see each other and talk with each other. And so, again, I think as tough as this has been on the health systems and the economy and on all of us, emotionally and socially and mentally, there's been some incredible bright spots that have come out of this. And I think we'll continue to see that as we work together and move forward and figure out what the new normal is for all of us.
All right. Thank you, Dr. French. I appreciate it. I believe we have Margo Karsten with us now. Margo, are you there? Make sure she's not muted. Actually, she was there and now she's gone, so I apologize. Next, I will introduce Jennifer Alderfer, who has been SCL's Health's Good Sam Medical Center's president since September of 2017 and the Health Systems Transformation Officer since January of 2019. Prior to joining Good Sam, she served within the HCA Health One system for almost 18 years, having been the president and CEO of North Suburban Medical Center in Thornton from 2010 to 2017. Please welcome Jennifer Alderfer.
Well, good morning, everyone. Thank you all so much for making the time to connect with us over this webinar. And I'd like to start off by just recognizing and thanking my colleagues who are a part of the panel discussion, as well as all of you participating in the webinar, as likely you are involved with, interested in, or have supported healthcare professionals over the course of the past 3 months. We have been tremendously overwhelmed by the amount of support that we've received from the community. And so I just want to give a shout out of thanks to all of you as we've all worked very hard to care for our communities in light of the COVID outbreak. I'd like to build upon some of Dr. French's comments about the amazing ingenuity and transformation in action that we've seen at our medical center with our colleagues who have really modified operations and redesigned care to best prioritize the COVID situation. So in addition to what Dr. French shared, I wanted to let you all know that here at Good Samaritan, we have sewed together over 9,000 face masks using sterile wrap. I did not know that we had some of the talented seamstresses and seamsters on our team that we had, particularly with our perioperative services colleagues that really came together and put those masks together, and we're using those right now in certain areas of the hospital. We also had a point in time where we needed to repair our PAPRs. PAPRs are, powered air purifying respirators, and we were able to locally source some plastic and sew together face shields for our PAPRs with our facilities team. In addition to using iPads to care for patients in the hospital setting, which really helped us to conserve our PPE, our personal protective equipment, and minimize the in and out of our care team members of our patient rooms. I also wanted to share with you a bit about the telehealth adoption across our health system for patients not needing acute care inpatient services, but rather needing to see their ambulatory-based physician or outpatient-based physician. And just by way of showing that rapid adoption, in the month of February, which if you can even remember way back in February, it seems like a long time ago now, we really weren't impacted by way of our the community surge on the COVID situation then. In SCL Health, we had under 70 virtual visits that month with our employed physician practices. And contrast that number to having well over 6,500 of those telehealth visits in the month of March, which shows that we were able to meet the needs of our community members. We were able to honor the stay at home and still allow them access to their outpatient-based physician. We also converted traditional anesthesia machines to serve as ventilators as we were preparing for intensive care unit surge. We were fortunate here at Good Samaritan to have some space, and we converted our PACU, our post-anesthesia care unit. We converted that to 16 additional ICU beds in preparation for surge. And then, of course, there are other things that may seem a little lower level from a clinical or operational standpoint. However, I would say that in healthcare, we've been fairly traditional in our approach to connecting, and so it would not be uncommon for us in healthcare to meet in person in a meeting room or a conference room, and of course that's been turned upside down over the course of the past 8 to 10 weeks. We're now meeting virtually. We're doing things via Google Hangouts that we wouldn't have needed to do before. Our waiting rooms have been transformed where we're honoring social distancing and have no chairs throughout the hospital. We're not dining in our cafeteria in the traditional ways that we once were. And of course, we've worked really hard in partnership with our community to appropriately restrict access and visitation and still ensure that we're connecting with our patients and their loved ones. So those are a couple of the things that I wanted to share by way of the real-time transformation that we've seen at Good Samaritan and SCL Health. So thank you for the time to share some of those examples as well.
Thank you, Jennifer. Next up is Kevin Unger, who serves as president and CEO of Poudre Valley Hospital and Medical Center of the Rockies, 2 of the 12 hospitals within the UCHealth system. He also oversees the UCHealth locations in northern Colorado, including Yampa Valley Medical Center, Greeley Hospital, Longs Peak Hospital, and numerous ambulatory medical centers. Welcome, Kevin.
Well, thank you, Jeff, and thanks for putting this together, and thank you, Anthem, for sponsoring this. And we just really appreciate the community outpouring that we have received through this trying time. Businesses that I know are suffering have gone above and beyond to support our health system. And we really can't thank you enough. Restaurants that I know are challenged just to make ends meet have been feeding our staff, which has been very much appreciated. The local communities have turned out and they've done parades with first responders, which has really lifted the spirits, and the flyovers have been a lot of fun. And just thank you so much for the response that we've received. And I just echo Dr. French's sentiments around our front line. And I have never heard through this pandemic anybody say that that's not my job. Everybody has just stepped up in just incredible ways and have done what they needed to do. But thank you all for your support of the health systems. We've been actually planning for a pandemic for probably 15 years. Always hoped we would never have to put these practices in place. And so what I've learned through this is very similar to our other speakers. I'm just so pleased with how everybody is working together. As Dr. Vissers mentioned, the collaboration between the hospitals and the cities and the counties and the communication has just been great to see. I know within UCHealth, we're doing things in weeks and days that used to take months and weeks. And so everything has been very speeded up, and I am surprised, very surprised and pleasantly surprised just at the pace of which health systems can adapt and make things happen. We were able to double and triple our surge capacity if need be in our intensive care units. And as Dr. Vissers mentioned, a lot of collaboration in terms of sharing and making sure that the PPE and vents get to the right locations so that everybody can take the best care of the patients that we can. Anything new to add would really be kind of the surge in virtual visits that we have seen. So the week prior to COVID-19 hitting Colorado, we were doing about 110 to 120 virtual visits a week. And right now through this pandemic, we're currently doing close to or just under 4,000 visits a day virtually. And so that's a huge change. And we're not sure that we're going to see the clinic volumes actually coming back, because people seem to be responding and appreciating the virtual option, which is kind of a big transition for us, but it has also been able to save us from having surges in our emergency departments, and has allowed people to avoid coming into certain locations that could potentially surge and create capacity issues for us. We've also seen an uptick in our inpatient length of stay. These COVID patients are challenging to take care of, and they are in the hospital for quite a bit longer than what we're seeing with our traditional flu patients. And so very resource intensive. We have discharged just under 550 COVID positive patients from the hospitals. Many of them walk out of the facility. Some of them don't, and they need a higher level of care, and they go to a step down unit. But we're pleased with the results that we're seeing, and that patients are recovering from the virus and are doing well. Just thank you so much for all you're doing. And with that, I'll turn it back over to Jeff for questions.
Thank you, Kevin. And now it is my pleasure to introduce Margo Karsten, who has joined us. She is the Chief Executive Officer for Banner Fort Collins Medical Center, McKee Medical Center, and North Colorado Medical Center, and has been in that role since 2016. In 2018, she became president of the Western Division in a dual role, but she currently serves as Western Division president. She provides overall leadership for 3 hospitals in the Northern Front Range and oversees an additional 13 acute and critical access hospitals in 6 states. Take it away, Margo.
Hey, Jeff, good morning. Can you hear me okay?
Sure can.
Awesome. So I'll just add a couple nuances. Kevin and I were on a city council meeting last night, and I always say ditto, right, Kevin? Because I think we've all had similar COVID journeys. And so a couple things, I'll just express gratitude again on the partnership. Early on, Kevin and I reached out to each other and said our jobs are to keep the communities healthy and not compete around COVID. And I just really appreciate that. And then on both sides of the freeway, the county commissioners, the health department directors have been awesome. We pulled together our surge plans, we communicated, and I think because of that, we have really tried our best to keep everybody safe. A couple of things that Banner's done that I hope is reassuring is about a couple weeks ago, as we were watching the prevalence come down on the acute care side, but still prevalent in our counties, is we want to reassure the public that we are safe. And so as mentioned, the emergency room department volumes are down, and we're concerned about that. I had a personal story in our neighborhood just this weekend where our elderly neighbor, I was out walking and he went down, EMS came, and he literally died of a stroke, you guys. And so people ask me, what can we do, Margo? Like, what can we do? Check on one another. What we're seeing is people are delaying their care. I worry as a nurse, why didn't I go check on him more frequently over the last month? And I didn't. And so what my worry is now is more about personal health, that we've all delayed it, and people aren't coming in like they should. So Banner put together a safety seal. If you go on our internet site, it lists everything that we're doing to make sure people feel reassured. If you need to come in, you're going to be safe. We're going to keep you safe, and don't delay getting care done because of COVID would be a request. The other thing I've been thinking about is businesses are coming back up and everybody wants to be safe as we try to restore the economy. There's just been some good lessons learned. I was at NCMC this morning and we put in a thermal scan. When you walk through, technology is amazing, as echoed by everyone. But even for employee screening, it's amazing what we could do to help the colleges and bigger employers feel safe and not make it expensive to screen their employees and their customer base. So I would just say, reach out to any one of us. We want to be a safe community, and we certainly have had a journey on how to get there. Similar to other numbers, we've saved 212 lives. Lots of people will ask, Margo, well, how is this different than the flu? It's very different. Multi-organ impact. I always say I'm young at 57, but I'm high risk because I have asthma. And that's probably the pre-existing condition that troubled me the most, is young people coming in with asthma and ending up on ventilators, which I didn't really see that with flu season. So as we look forward to the fall, I think the best thing we can do as health partners is educate the community, get your vaccines, get your flu shots. Let's get you super healthy this summer, walk, run. We want to get you to be your healthiest. We don't want to see you tucked in our beds. And I think if we can do a full court press on as health providers, and let's try to not have anybody hospitalized this fall, would be amazing, because what I'm curious about is a combination between flu and COVID, and what might that look like for our community. So health strategies is what I'm going to be working on this summer, so we never see you all tucked in our beds this fall would be my victory.
Awesome. Thank you, Margo. Much appreciated. All right, it's time for questions, and I'm going to hand the mic back over to Charles Ritz at Anthem. We have, by my count, Charles, about 13 in the queue. So for all of our attendees, okay, if you want to get your questions in, you should do it now, given the amount of time that we have left. All right, are we ready for the first question?
Yeah, perfect. This one comes from the audience. I'll direct this one to Dr. Vissers. You brought up the topic of testing. And the question is, there's a lot of information out there on the reliability of COVID tests. What are your thoughts on how confident the medical community is that the tests are accurate and reliable?
Well, there's really two types of tests. I mean, there's all kinds of variations of them, but there's two main types of tests, and the answer varies on the test. So the test that we use to see if you're currently infected with COVID or with coronavirus, to see if you have COVID, is an antigen test, or it detects the RNA of the virus itself. That's incredibly sensitive. It only takes, depending on the test, a few hundred viral particles, and when you sneeze, you're producing millions if you're very sick. So that test is very sensitive. In fact, its sensitivity is such that we're seeing people, some of our employees that tested positive early on, that are still positive 4 or 5 weeks out, and we think it's because it's picking up these viral particles that probably aren't necessarily infectious. Certainly, these patients have been asymptomatic for several weeks. So the test, but the problem is that test only tells you if you have the COVID virus in your system. It doesn't tell you if you've had it in the past, or more importantly, does this confer some immunity? And so that second test, the antibody test, is the one where you're hearing a lot of mixed reports. And part of it is because there were many, many antibody tests that were pushed out and approved in a much more rapid fashion than normally would allow for testing to see just how accurate it is. And there's a number of different variables that I'm not going to bore you with, but what it does is after you get an infection, you produce different types of antibodies. And depending on the antibody you test, it tells you whether you've recovered or whether you're still experiencing it or in the middle of that. And so the challenge with this test is how specific it is. And so even the good tests that are 97% specific, meaning if it's positive, it says, hey, it looks like you had coronavirus at some point in the past several months. Even if it's only 3 or 4% false positive, meaning, hey, it looks like you had it, but that's not really true. That's if you're applying it to people that you suspect probably had it. But if you start applying it to a population where, like I just showed you, probably 99% of our population has not been exposed to it, then all of a sudden you get a lot more of these false positives. And so some of these tests, if you're just ordering randomly, half the time it says that you have positive antibodies, but it's actually an antibody to a different coronavirus. Even though it's most of the time it will be negative, just because the disease itself has still been, in our population, relatively low in incidence. And so the challenge with the antibody test right now is, what does it mean? Does it mean that I actually had it, or is this a false positive? And then the second issue is, even if I know it was a coronavirus, does it infer that I have immunity? So does this mean that I get to go around and assume that I'm immune to the disease? And we don't know that either, and we may not know that for months. So the challenge around antibody testing, although I think is very promising and an important tool as we sort this out epidemiologically, is that it's a bit early, and we're still trying to figure out the accuracy and what a positive actually means. And the worst part would be is if someone got a positive test, turns out it wasn't correct, and they behaved as though they had some immunity. So that continues to be a challenge. On the other side, and that's a different question, but I think what we really need now is a lot more of the antigen testing. And we've been particularly challenged to figure out what's going on in our community just because of the significant limitations there, although it is opening up.
Thank you for that. This next question is pertaining to employer settings. So as the businesses reopen and our economy begins to open up, what recommendations would you have for employers in your community in terms of establishing testing or symptom protocols? And then secondly, what services, when would it be appropriate for an employer to have services deployed to their work site versus virtually or in a clinical setting?
Jeff,
and I'll throw that out to the panel at large.
Jeff, I'm happy to start. It was interesting. Like I said, Kevin and I were just on Loveland City Council. I would say very close to your health department directors. They are in an incredible role to watch what looks safe from their perspective by each city and each county. And I've just been really impressed with Dr. Mark Wallace and Tom Gonzalez. They have good metrics to watch and checklists to provide businesses on what that might look like for each business. I bet they're seeing some, Tom alluded to last night, some best practices that restaurants have in place. So for me, if I'm a business, my first place to go to would be my local health department director. They just seem so well versed in how to be safe as you bring the businesses up. And then if they have any logistic questions, businesses, Banner Health is happy to help as well. I was on a panel with Dr. B from Ames, very thoughtful phase-in process for her students and faculty. So I think we're all trying to do our best, and because healthcare has been living employee screening and what does that look like for the last 9 weeks, I think any one of us, I don't want to speak for all of us, but I bet any one of us would be happy to help if they want to learn from the logistics end of employee screening. And I just be cautious. If this is a time to go slow to go fast. And what we don't want to do is have an employer be excited to open and then unintentionally have a negative consequence for their employees or customers. So I think reach out to your health department directors, and I bet any one of our health systems would be happy to help as well.
Perfect. Thank you so much. Kevin, perhaps you could just share anything that UCHealth has done. You guys have, open, active employee populations coming to the workforce on the front lines every day. Maybe you could share from an employer's perspective some of the protocols you guys have put in place to protect not only your employees, but the patients that come through your doors.
Yep, absolutely. And so we much like Margo explained, are following the county requirements and looking at what that looks like. We are requiring masks in all of our locations because that is an ordinance that was put in place by Larimer County. And so we're following that throughout all of our different facilities. But we are starting to work on that reactivation phase. And so I want everybody to know that our hospitals are safe and we are seeing patients and we are open for business. And much like Margo explained, there's no reason to put off care at this point. We are now expanding our visitor policy. We've dropped below that 20% COVID positive in the hospitals. And so we are now allowing a visitor at Poudre Valley Medical Center of the Rockies. We're still slightly above that number in Greeley. And so we're pumping the brakes on expanding the visitor policy at the Greeley Hospital. But we're working really hard from a reactivation perspective to come back online. And we're making sure that we are not allowing patients or visitors into the facilities that have active COVID symptoms. And so we're screening them at the door and just making sure that we're keeping the facilities clean.
Hey, Charles, can I add,
Kevin.
the other component is,
Yes.
I bet most of us have attestation screens that pop up on your computer. And so there's just built-in safety mechanisms that every 4 hours, it'll come up and you got to attest that you're symptom-free. And also with our ORs, we're doing mid-shift temperature checks for all personnel. So there's so many gatekeeper moments to keep people safe. That's why I think any one of us could walk them through the employee screening process.
Perfect. And this is a sort of a combination of several questions around the theme of restarting the elective procedure aspects of your businesses. When do you see elective procedures coming online as part one of the question? Part two of the question would be, how long do you think it will take for the healthcare system sort of catch up with the prior deferral of elective procedures? Is that 60, 90, 120 days or a longer deferral tail? And then the third part of the question is, what are you doing as systems? I think you spoke to some of this, Margo, but doing as healthcare systems to create a safe environment in which members of the community feel comfortable, entering your facilities for the purpose of having those elective procedures that have been put off over the last 60 or 90 days. Perhaps we could defer start with Dr. French on the first part of that question.
Yeah, absolutely. And there's a lot of questions kind of buried in there. So I'll kind of take them a little bit piecemeal, but feel free to redirect on any specific topic. So I think Kevin and Margo already touched on quite a few things that we're doing in terms of ensuring the safety of patients and staff as they enter the hospital and as we re-engage on some of these additional surgeries and other procedures that fall into that kind of general category of electives. And those things are everything from symptom screening to temperature screening. Dr. Vissers touched on this a little bit earlier in his opening statements, but what I think a lot of the systems are doing, certainly Centura is doing this, is for any of these surgeries that aren't emergent, what we're actually asking patients to do is to monitor their own symptoms, including their temperature at home, for a period of days leading into the surgery. And then we're actually performing pre-procedure COVID testing. So as many people have seen in the media and in the news, there can be a fair number of patients who are pre-symptomatic or asymptomatic who may have COVID. And obviously bringing those patients into the hospital is a risk to staff, it's a risk to other patients. And so in order to ensure that we're not doing that, about 48 hours prior to any elective procedure, we're actually testing those patients for COVID in the chance and the slim chance that they would return positive. That would allow us to have the thoughtful pause and discussion around whether or not this procedure or this surgery absolutely needed to happen, or if it could wait another couple of weeks to see if the patient develops symptoms, or to let the COVID disease run its course. And so we're taking multiple steps, I think, both from the staff perspective, from the patient perspective. In addition to that, even with the COVID testing itself pre-procedurally, we've set up sites to test these patients where they are separate and completely apart from where any other patients coming in that would be sick or to seek care would have any interaction with those patients. And so if you're coming in for pre-procedural testing, you're going to get tested, but in an area that's divided off from where any other patients coming in who might be sick or who might be experiencing symptoms that you would interact with. And so we're taking multiple steps from that perspective. In terms of the backlog of the surgeries, I think that's dependent on a couple things. I think that's dependent on if and when we start to see an uptick in COVID-related symptoms within the communities. It's also, I think, dependent on something that almost every single one of us touched on so far, which is the trust in the community, in them feeling safe to re-engage with the hospitals and the health systems. And so while I feel personally as a chief medical officer, feel very comfortable in terms of the safety measures that we've put in place, and again, I know every single one of us has done something similar, there's still an element of ensuring that we communicate that effectively to our community and to our patients so that they feel safe coming in. And so I think that's a big unknown that could take some time for people to feel comfortable seeking care, just as Margo mentioned, for the patients delaying seeking care for other reasons. So other than that, I certainly welcome the other panelists to jump in and provide input on this as well.
I think it'll be an interesting perspective, and every community likely will move at a different pace based on known infections within facilities, et cetera, and the comfort and the good work that you guys are doing. As I said before, I think it's remarkable the flexibility to move into a COVID environment and now move back out to serve the different populations that have done their part of staying at home. I think you guys have done a remarkable job. I want to bring Jennifer into the conversation discussion on the topic of telemedicine. There's several questions with regards to, not only, you guys have mentioned sort of the significant uptick in televisits and virtual healthcare visits. Is it here to stay? And how are you changing your business model to accommodate more tele or virtual healthcare visits?
Well, thank you, Charles, for the question. Before I talk about telehealth and that adoption, I did just want to touch upon another piece as it relates to the reinstatement of the elective surgical and procedural work, in addition to what Dr. French shared. And I do want to provide the webinar participants with some assurance that we're looking at each and every case that's being rescheduled or scheduled with our perioperative medical director and our chief medical officer to ensure that they're medically necessary. We're also looking at the times that we provide surgeries and expanding that outside of normal operations, if you will, to accommodate some of that backlog if necessary. And then here at Good Samaritan, we're fortunate that in the midst of all of the COVID-19 outbreak, we had an ambulatory surgery center on our campus in one of our medical office buildings under development that we were able to finish construction on. And so we're excited for that to go through the surveying and approval processes to have an ambulatory setting to offer as an alternative site to the hospital to help our surgeon partners accommodate patient needs. Way back in March, things that might have been elective in nature over the course of the last several weeks have likely turned to be more medically necessary and urgent or emergent. So we're just doing all sorts of things to partner with our physicians to make sure that we can take care of patients. And that really just speaks to some of the things that Margo had mentioned about our desire to not delay things further so that we can care for our communities. On the telehealth side, I would just share with you, we all had been doing telemedicine in some way or another prior to the COVID outbreak. I think what this has just shown us is that our community members, our patients, are willing to adopt alternative mechanisms to connect with physician partners where someone may have been hesitant to use the technology before. There's just so much more acceptance of it, if you will. The technology, as we can see doing this Zoom webinar, is actually really accommodating, and it's quite easy to connect over the phone or over a Zoom, or who knew about House Party before COVID, right? Many of us and our friends are probably connecting over that app as well. So we're watching it closely, but I would just share with the participants that I wouldn't say this is a brand new strategy for us. It's actually an enhancement and a building upon some of that investment that we had, but it's certainly been escalated as we've seen our adoption rates improve significantly. I'm sort of laughing to myself as my numbers within SEL paled in comparison to what Kevin had shared in UCH with 4,000 visits on a daily basis. So he might have more to add from the UCH perspective on this.
Yeah. Kevin, do you want to extend upon that response?
We just can't believe the explosion in those virtual visits, and we've been trying to ramp up, and we've certainly redeployed providers and internal med and primary care doctors to the virtual environment when they were so used to being in the clinics. When I speak to our cardiologists, they believe, and they just can't see going back on doing the follow-up exams and a lot of the more routine efforts. They believe that this is kind of our new world going forward, and we're all going to have to kind of flex and figure out what that looks like as we move ahead post-COVID.
Yeah, thank you for that additional context. Dr. Vissers, if I could direct this next question to you. There's several questions around hospital at home, and it's been an emerging trend, and it's hit a lot of publications, and it's taken hold in certain aspects. Could you perhaps expand upon your perspective of hospital at the home and how you see that potentially becoming more prevalent post-COVID environment?
That's a great question. Just to explain to the others, because I'm not sure I could have translated that term a year ago, is hospital at home is when you have somebody that normally might have waited a day or two to be discharged, but they go home and are able to still receive a lot of the same services that you might get in the hospital. And in some cases, and we are doing this now, we've had some patients that historically or normally would have admitted, and we had one patient recently who, he would get admitted to the hospital almost every 2 or 3 months, very well known to us, provider, and we were able to put the support that we normally utilize in the hospital into his home so that he never had to be admitted to the hospital. And that means remotely utilizing monitors on their oxygenation and their blood pressure and their heart rate, using home health nurses to bring their medications and ensure their safety. And this has been piloted in a number of places in the past several years. And a lot of the data suggests that if you pick the population correctly, they actually have better outcomes. And it does make sense. People are usually more content at the home, and if they have the support structure around, it's safer for them. They understand. I mean, just even preventing falls in the hospital is challenging because it's a strange environment, and they're trying to get to a bathroom that they've not used before and perhaps can't get the light on, et cetera. So being in an environment like that, in some cases, can be safer. The outcomes are good. And as you can imagine, it's much lower cost. So that's another great example of how this is driving innovation that I think will make us a better healthcare system at the other end of this. There's really three things, and this is just like telehealth as well, that seem to have to take place before we can move into these places. And one is the technology and the ideas and support, the innovation behind it. And I think, I know for us as an organization, even a year ago, we would not have been able to move forward with telehealth as robustly if we hadn't started on that platform and strategy. I know UCHealth built a very robust telehealth system that wasn't in existence a year ago, even though I know they had the platform. So there's that. And then there's the behavioral change. And this has really driven a lot of changes that, you know, I can tell you as a doc, we're somewhat change averse. We like to do things the way we always do them because they work, and we think we get better outcomes that way. And so this has driven behavior. The last thing, though, that has been important is regulatory changes. And there are a few industries as regulated as healthcare. And when we try and adapt and we try and move quickly, we often bump up against those. And there have been many waivers, including around telehealth, that have allowed us to move much more quickly. And that's something I think we all on the call hope is retained afterwards. I think we'll be able to be a much more agile industry, much more cost efficient, if we can move the regulatory environment to keep up with this as well, including the insurance company, Charles, you know, and I think there has been a movement, much more quick adoption of being able to pay for these services, because in the end, we'll all save money, the patients, the health systems, Blue Cross Blue Shield, if we're able to do things at lower cost with better outcome. And at the end of the day, that's what we're all trying to do, and we have been doing for years. This is an accelerator. So that's a great question, because it's another great example of, I think, how a year from now we're going to be better, hopefully, for this.
Yeah, thank you for that response. Jeff, do we have time for one more question?
Yeah, we certainly do. There are actually still hundreds of people still participating, so let's ask a couple more if you like.
Yeah, there are. So I'm going to direct this one to Margo, just given your experience with multiple states, multiple communities across your footprint. As we think about the fall and winter flu season and reopening our communities and our businesses, and the reality that potentially there could be a spike in positive COVID incidents in various communities. What have you learned through this process that gives confidence that the system can flex to meet the needs of that uptick without potentially the need to completely go back to what we just experienced in the last 60 days to ensure that we have the capacity for those that are severely affected?
Yeah, that's a great question. A couple of things. I think most of us have now concurrent dashboards that we watch all the time. PPE and segmented by masks and sanitizing wipes and gowns. And so I think we all have dashboards that are going to alert us on when we're getting to dangerous low levels in whatever that looks like, ICU beds, ventilators. Early on, we have this beautiful dashboard on medications, because as we were seeing our ventilator use go up, we were burning through propofol, which is a drug like I've never seen. Mm-hmm. And so I think right now where I feel good is throughout all of our systems. If it's a small critical access hospital to a very large facility like NCMC, we have these early warning signs that we can just look, oh, we're green on PPE and all the way down through PPE. So that's reassuring. I would say the good work that all of us have done, as mentioned, on bed capacity. And so I know Kevin's surge and he knows mine, and I don't think that'll ever go away. And so we'll know in the communities we serve what that looks like. In the rural communities throughout the 6 states, what we've done is now they know who their tertiary partner is, and they have real-time bed capacity. what worries me the most, and my new words are, let's learn how to live with COVID, is surges, because we don't know when they're going to happen. And so I have Page, Arizona, near a Navajo reservation. And so they might have exquisite infection prevention at the local industry level, and you just have one surge in a reservation or a big employer or a nursing home that will put stress on all of us. So I think for the rest of our careers, it might not be COVID, it might be something else. What I've learned is a great partnership that Kevin and I have established, that we're gonna have to keep that together, you guys. As a health system, Denver Health has been awesome. We've watched a prison by Sterling. There's no way we'd all have capacity for those prisoners if it would go in a really hard direction. They've been awesome. Children's been awesome on running lab tests for us. So I think that's what's key. If I believe this to my core, our jobs collectively is to keep the community health in our core and keep us safe. And we can only do that working together, and then we can face the fall together in that manner.
Perfect. Thank you so much for that response. Very thoughtful. And perhaps to wrap things up, we could just pose this to all of the panelists. And I'll start, Kevin, working left to right in my tiles. Kevin, Dr. Vissers, Jennifer, and then back to you, Margo. What have you learned from this crisis? And I would encourage you to feel comfortable maybe sharing something personally that you've learned, as well as, in your professional business settings. You can feel comfortable.
You bet. I'll kick it off. This is Kevin Unger, and I would say just the flexibility that I've seen within our workforce and the ability to get things done quickly when it's time to get things done quickly, and then the collaboration, as Margo has kind of stressed, of the different systems working together and really operating as one has been really enlightening. What I've learned personally is just how much I think I thrive on personal interaction and being on the floors and being out and about, and how challenging it is to have to flex to a different leadership style when we're not all in the same room, or I can just run up to the floor and interact with people routinely. I'm craving that, and it's really made me rethink kind of how I lead, and I'm finally getting used to these virtual meetings, and it has made us very efficient. And so while I was spending a day, a week or more running to Steamboat and to Denver and to all these different locations, the virtual world has made me much more productive, but I'm sitting so long. I need to get up and move more. And at least I used to have the opportunity to get a little bit of motion moving from one meeting to the other. And now I found myself, you can go a day and I'm still sitting in the same place. And so I gotta just keep reminding myself to keep active.
Yeah, awesome. Dr. French, would you care to reflect?
I think as something professionally that comes to mind, I think is a little bit what Kevin discussed. This is a situation in healthcare, whether it's the state, whether it's nationally, whether it's internationally, that frankly nobody working in healthcare has really ever encountered anything like this. And subsequently, what that's required is people to, frankly, to have to adapt and respond and to be flexible with everything from how they provide bedside clinical care to adjusting to protocols, things like that. We kind of laugh, but it's the truth. Sometimes on a 24 to 48 hour basis where major protocols are changing. And the way that our systems have worked together to do that, the way our frontline providers have come together to do that, has actually just been completely astonishing. I think for me personally, it's been about how to maintain the personal connection and maintain the concern and expressions of those concerns for our people and their mental health and well-being and emotional well-being while to Kevin's point, while you're stuck somewhat physically isolated, and reinventing ways to do that, I think is absolutely key.
Perfect. Thank you. Dr. Vissers, anything personally that you would care to share? You're on mute. Dr. Vissers, you're on mute.
Gosh, it was really profound.
It was an incredible response, by the way.
It was, yeah. See, after like 6 weeks, Kevin, I still can't figure out the mute button. So you're not alone. I think, like the others, I've been struck by our resiliency, our ability to adapt and change quickly, just how robust and high quality the healthcare systems are across the Front Range in northern Colorado. And all of us have been struggling with the challenges we face in healthcare and some of the unsustainable economics, and it feels insurmountable. I think after what we've gone through, I think we all appreciate that we are capable of meeting these challenges much more directly, and it gives me a lot of optimism for the future. It also has highlighted some of the failures of our reimbursement model in the system. Every one of us is going to have a really, really hard year economically, yet it's hard to think of a year where we've really stepped up and served the community in a more meaningful way. And so if this isn't a call for action and change, I don't know what is. And then the final thing is just the engagement of the community. And I don't think after this, the community will look at their health systems the same way. The collaboration between public health, city council, the governor's office, and everybody on the call and the other CEOs is also unprecedented. And so that has been the importance of that and the need for that to really move forward in large scale things like this, but also solving our healthcare issues that we still continue to face. That was certainly meaningful to me. So I look forward to 2021 and learning from 2020.
Oh, perfect. Well, hey guys, I apologize. I do have to jump to a meeting that started at the top of the hour. I really appreciate having the opportunity to be a part of this discussion, and thank everyone. And Jeff, perhaps you could facilitate the last two responses real quickly from the panelists. Thank you all for your participation, great dialogue, and thanks for including us.
Oh, you bet, Charles. Thank you so much. Jennifer, did you have some last words?
Sure. I'll just share with you professionally. I have been reminded of the value and importance of our infection prevention clinical experts. So we are so fortunate here at Good Samaritan have 2 infection prevention nurses, and then of course our infectious disease medical director. And what a blessing they have been to our team in shepherding us through understanding how to best modify our operations and our care delivery for the sake of the patients that we're serving. So every once in a while in your healthcare career, you're reminded of the value that certain clinical experts bring. And for me, COVID has brought our infection prevention partners top of mind. On the personal side, I've learned that I take a lot of things for granted. And I'm a very positive and upbeat person, but I will share candidly that I've had a few blue days where I've been a bit disillusioned by some of the changes in our world. My son is a senior in high school, and he's missed out on some spring semester milestones that come with marching towards graduation. And so I've been disappointed a bit for him. And I've really just been buoyed by the meaningful work and the purpose that healthcare gives us as healthcare professionals. So that has helped me on the personal front. Thanks for allowing the time to share that this morning.
Of course. And Margo?
Yeah, I would say I'm a nurse since 1984, and I always was impressed by physicians and nurses and everybody in healthcare because you work 24/7. The personal sacrifice and the commitment that I have seen has taken my breath away. I'll just say that. Physicians not get in RV because he didn't want to expose his immunosuppressed wife. People not being with their children. nurses not seeing their kids. It's just been unbelievable. So it has really just reawakened for me a sense of gratitude and just gratitude for our frontline people. And then at a personal level, similar, Jennifer, I have a daughter who's a junior in high school, and it's helped me really. I like Brene Brown, so I listened to her whole, I just really encourage this, her unlocking and just labeling feelings and being okay. She calls it comparative suffering. So I was like, I gotta be grateful because I'm not vented right now. And she just acknowledged, you know what, feel what you feel. And so just spending some good curiosity with people, trying to figure out their story and what they're going through in life. I need to pause more and be more curious and be more understanding is what I've learned.
Thank you, Margo. All right, well, let's wrap things up at this point. I know we've gone a little bit long, but I appreciate everybody hanging in there with us. I want to, again, encourage you all to respond to the survey that you'll be getting after this. We'll be sending you all access to the recording as well, so you can recap notes. BizWest is going to continue with COVID-19 coverage with our daily emails, our newspapers, and webinars like this. You can see that we have a couple more coming up before the end of the month. I want to thank all of you for attending today. I want to thank all of our presenters. What an inspirational conversation this has been. If I may, I'm extremely proud of all of you and your teams. I'm reminded today that humankind is truly remarkable. When we are faced with unsurmountable challenges, seemingly unsurmountable, we always seem to get creative and work hard and pull through, and it really is inspirational to me. So thank you all very much. I want to thank our sponsors again, Anthem Blue Cross Blue Shield and Caplan Earnest. Everyone, please stay safe. Enjoy the rest of your day. That's it for now. Thank you.